We are continuing on module number 5. If you have not completed the assignments last week, you have been granted a reprieve. I've changed the due dates to this Friday. So happy Monday, everyone. We are continuing with chapter 4. I believe you are currently up to cocaine, so that is where I will continue from. Now, I know that you've heard of it before, but what is it exactly? Cocaine is a powerful stimulant drug that comes from the coca plant, which grows mainly in South America. In medicine, a purified form of it is sometimes used as a local anesthetic for numbing during surgeries. However, in recreational use, it's an illegal drug that is usually found as a white powder or in a crystallized form known as crack cocaine. Some of the characteristics are the type of drug classification. Cocaine is considered a stimulant, speeds up activity in the brain and body. The forms are generally seen as a powder, snorted or injected, and crack, smoked. Then you need to understand the actions it has in the brain. It increases levels of dopamine. Remember, that's the feel-good neurotransmitter, which causes intense euphoria, but also makes it highly addictive. So, the onset and duration is, the high starts quickly, within seconds to minutes, but wears off within 5 to 30 minutes, leading to repeated use in short bursts, so binges. Now let's look at the effects. First, we'll talk about the short-term effects. There's the euphoria, the intense pleasure and confidence. A person will have an increased energy and alertness, decreased appetite, faster heartbeat, higher blood pressure, dilated pupils, talkativeness, and restlessness. Then you have to consider the negative or dangerous effects. One may experience anxiety, paranoia or panic, aggressiveness or irritability, chest pain, irregular heartbeat, or even heart attack, seizures and strokes at high doses. So a person that has either abused or become dependent on cocaine will go through withdrawal symptoms when they have not been using. When people stop using cocaine after regular use, they may experience a crash followed by withdrawal. Unlike alcohol or opioids, cocaine withdrawal is usually not life-threatening, but it can be very uncomfortable and increases the risk of relapse. Common withdrawal symptoms: intense cravings for cocaine, fatigue, exhaustion, and sleep problems, insomnia or oversleeping, depression and low motivation, irritability and anxiety, difficulty concentrating. Now let's look at MDMA, or the street name ecstasy. Actually, the full name is methylene dioxymethamphetamine. You can see why people stick with MDMA or ecstasy. MDMA's category is a synthetic drug, meaning it's man-made inside a lab. The type of drug, it acts as both a stimulant like cocaine or amphetamines and a hallucinogen like LSD or psilocybin. Street forms and names: usually small, colorful pills, capsules, or powders, called ecstasy, Molly, E, X, etc. Some of the characteristics: increases levels of serotonin, dopamine, and norepinephrine in the brain. Known for creating feelings of energy, emotional closeness, empathy, and sensory enhancement. Often used at parties, clubs, or raves, but not limited to those settings. Short-term effects: positive reasons why people take it: increased sociability and emotional connection. I feel so connected to everyone here. Heightened sense of touch, sound, and color. More energy and less fatigue. Negative risk: jaw clenching, teeth grinding, nausea, sweating, chills, increased heart rate and blood pressure. Dangerous for people with heart problems. Dehydration or overeating, especially in hot, crowded places. Confusion, anxiety, or paranoia. In the long term or repeated use. Possible damage to brain cells that produce serotonin, which regulates mood, sleep, and memory. memory problems and trouble concentrating, depression or anxiety in the days, weeks after use, suicide Tuesday effect when serotonin crashes. It causes sleep problems, withdrawal symptoms. When someone stops using after repeated use, they may experience fatigue, low energy, irritability, depression or anxiety, difficulty sleeping or vivid dreams, poor appetite, cravings for the drug. So remember, MDMA tricks your brain into feeling super social, loving, and energized, but the crash can be rough. The risks go beyond just a hangover. It can cause long-term mood and memory problems. It's a short-term high with potential long-term costs. Nicotine. We've all heard of it. You can buy it at Walgreens or Walmart. But what is it? The type of substance. It's a stimulant drug found naturally in tobacco plants. Delivery methods. Most commonly through cigarettes, cigars, pipes, chewing tobacco, and vaping, e-cigs. Addictive nature. Nicotine is highly addictive as heroin or cocaine, because it changes how the brain's reward system works. Characteristics. Fast acting. When smoked, nicotine reaches the brain in seconds, giving an almost immediate effect. Neurotransmitter release. It stimulates the release of dopamine, pleasure, norepinephrine, alertness, and acetylcholine, attention and focus. Tolerance develops. Over time, the brain adjusts, so people need more nicotine to get the same effect. Addictive effects. Short-term effects. Increased alertness and concentration. Mild euphoria, pleasurable feeling. Reduced stress or anxiety, though in reality, nicotine is just calming the withdrawal symptoms it caused. Increased heart rate and blood pressure. The long-term effects. High risk of cancer, heart disease, lung disease, COPD, emphysema, and stroke. Worsened immune system functioning. Premature aging of skin and other organs. Withdrawal symptoms. When someone stops using nicotine, cravings and irritability, anxiety, depression, or restlessness, difficulty concentrating, increased appetite and possible weight gain, trouble sleeping. These symptoms make quitting extremely hard, and many people relapse multiple times before succeeding. I was a smoker for over 40 years. Quitting was one of the hardest things I've ever done, because nicotine isn't just a habit, it rewires your brain and body to crave it. What finally pushed me to stop was a serious health scare, getting COVID-19. The experience forced me to face how vulnerable my lungs already were from decades of smoking. I've now been smoke-free for almost 5 years, a huge milestone that feels like regaining control over my health and life. But I emphasize this for students. This next drug we all have used in one form or another. What is it? Is our take on caffeine? Here's a simple definition. Caffeine is the most widely used psychoactive drug in the world. Where it's found: coffee, tea, chocolate, soda, energy drinks, and even some medications like pain relievers. Drug class: a stimulant. It speeds up activity in the brain and nervous system. Caffeine characteristics include fast acting, usually kicks in within 15 to 45 minutes after drinking. Half-life, it stays in your system for about 4 to 6 hours, longer for some people. Mechanism: caffeine blocks adenosine receptors. Adenosine makes you feel tired. With those blocked, you feel more awake. Effects: short-term effects, increased alertness and concentration, improved mood and feeling more energetic, faster reaction times, higher heart rate and blood pressure. temporary boost for staying awake during study sessions. Too much caffeine can cause jitters, restlessness, or anxiety, trouble sleeping, especially if consumed late in the day, upset stomach or increased urination, rapid heartbeat or palpitations. Long-term heavy use may contribute to sleep problems, digestive issues, and dependence. Withdrawal symptoms. If you're used to caffeine and suddenly stop, you may experience headaches, classic caffeine withdrawal symptom, fatigue and sleepiness, irritability or low mood, trouble concentrating, flu-like symptoms in severe cases. Symptoms usually start 12 to 24 hours after last use and can last 2 to 9 days. Caffeine feels harmless because it's in everyday drinks like coffee and soda, but it's a drug with real effects on the brain and body. It can improve alertness, but overuse leads to jitters, poor sleep, and dependence. The need for morning coffee isn't just a habit, it's often withdrawal relief. Next is hallucinogens. They're a group of drugs that change the way people perceive reality. They can make you see, hear, or feel things that aren't really there. Examples: LSD, acid, psilocybin, magic mushrooms, mescaline, peyote, PCP, angel dust, and ketamine. Their category: they're sometimes called psychedelics because they alter thoughts, moods, and senses. Hallucinogens' characteristics involve effect. Serotonin, a brain chemical that controls mood and perception, cause hallucinations, changes in how time and space feel, and strong emotional swings. Effects vary a lot depending on the type of hallucinogen, the dose, the setting, safe versus unsafe environment, the person's expectations and mindset, set and setting. Looking at the effects, we start with the short-term effect shows intense visual or auditory hallucinations, altered sense of time, minutes can feel like hours, strong emotions, euphoria, awe, fear, or paranoia, dilated pupils, sweating, nausea, increased heart rate. The risk of using includes bad trips, terrifying hallucinations and panic, impaired judgment leading to risky behavior, flashbacks, reliving parts of a trip days or weeks later, long-term effects possible with repeated use, persistent anxiety, paranoia, or depression, hallucinogen persistent perception disorder, HPPD, recurrent hallucinations even when not using. Withdrawal symptoms is more specific. Unlike nicotine or opioids, most classic hallucinogens don't cause physical withdrawal symptoms. However, some users may experience fatigue or afterglow hangover. Difficulty sleeping can create mood swings or depression. Then there's the cravings, psychological desire to repeat the experience. So to recap, hallucinogens dramatically change perception, thought, and emotion. Some people describe life-changing insights, but the flip side can be frightening and risky. They usually don't cause physical withdrawal, but the mental effects like flashbacks or anxiety can last long after the trip ends. This is a drug that's not as common as it was in the past. What is LSD? Full name: lysergic acid diethylamide. Street names: acid, blotter, dots, tabs. Category: a hallucinogen/psychedelic drug. Form: usually a liquid placed on small squares of paper, blotters, but it can also come as tablets or capsules. It started first or initially synthesized in 1938 from a fungus called ergot that grows on rye. Characteristics: extremely potent. A tiny dose, micrograms, can cause powerful effects. Not addictive in the classic sense. LSD doesn't cause physical dependence, but people can develop tolerance quickly. Unpredictable effects. The experience depends heavily on the user's mindset, and environment, setting. Some of the effects are short-term effects, the trip, visual and auditory hallucinations, seeing patterns, colors, or objects that aren't there. Distorted sense of time and space, minutes may feel like hours. Intense emotions, anything from joy and awe to fear and panic. Physical signs, dilated pupils, sweating, increased heart rate, dizziness. Possible negative effects, bad trips, frightening hallucinations, paranoia or panic. Poor judgment leading to accidents or risky behavior. Anxiety or confusion during or after the trip. Long-term effects, flashbacks, reliving parts of a trip days, weeks, or even years later. Hallucinogen persisting perception disorder, HPPD, ongoing visual disturbances like halos or trails. Mood problems such as depression or anxiety in some users. Withdrawal symptoms, physical withdrawal. Unlike nicotine or opioids, LSD does not produce physical withdrawal symptoms. Psychological effects. After heavy use, people may feel fatigue or drained after trips, trouble sleeping, irritability, mood swings, or anxiety, cravings to re-experience the trip. So remember, with LSD, it is one of the most powerful hallucinogens. It can cause vivid, mind-altering experiences that some people see as enlightening, but it can just as easily cause terrifying bad trips. While it doesn't cause physical withdrawal, the psychological after effects and risks, like accidents, flashbacks, or anxiety, can make it. It's time to check your knowledge. Which of the following drugs stimulates the central nervous system by blocking the reuptake of dopamine in the synapse between neurons, producing a state of pleasure? Is it A, psilocybin, B, PCP, C, opioids, or D, cocaine? So, did you get the answer? Well, if you said D, cocaine, then you are on target. As previously said, cocaine is a stimulant drug that produces a state of pleasure primarily by activating the brain's reward pathways, creating feelings of well-being. Psilocybin is a hallucinogen derived from certain mushrooms. PCP is a synthetic hallucinogen that produces a state of delirium. Opioids are narcotic drugs that have pain-relieving and sleep-inducing properties. Next up is cannabis. Other names: marijuana, weed, pot, ganja, plant-based drug. Comes from the cannabis sativa or cannabis indica plant. Main chemicals: THC, tetrahydrocannabinol. The ingredient that causes the high. CBD, cannabidiol, non-intoxicating, often used for medical purposes like pain or anxiety relief. Forms: smoked, joints, blunts, pipes, bongs, vaped, eaten, edibles, or used in oils, lotions. Some of the characteristics. Drug class. Cannabis is both a depressant, slows the body down, a stimulant in some users, and a hallucinogen, changes perception. How it works. THC binds to cannabinoid receptors in the brain, especially in areas tied to memory, pleasure, coordination, and time perception. Effects. First, the short-term effects. Relaxation, euphoria, high, laughter. Increased appetite, the munchies. Altered sense of time, heightened sensory perception. Music or food may seem extra enjoyable. Slower reaction time, impaired coordination, memory problems. Anxiety or paranoia, especially at high doses. Although there are advantages to using marijuana, the long-term effects from heavy use may affect memory and learning difficulties, lower motivation, amotivational syndrome, though debated, lung irritation if smoked, possible increased risk of mental health issues like psychosis in vulnerable individuals, withdrawal symptoms, Cannabis is less addictive than nicotine or opioids, but people can still develop cannabis use disorder. When stopping after heavy use, irritability, anger, restlessness, difficulty sleeping, vivid dreams, decreased appetite, anxiety or depressed mood, cravings for cannabis. Withdrawal usually starts within 24 to 72 hours and can last about 1 to 2 weeks. The legal history of cannabis. Early U.S. history. Cannabis was legal and widely used in the 1800s for medicinal purposes. Hemp, a non-psychoactive cannabis plant, was grown for rope, paper, and fabric. 1930s. When we attempt to understand drug misuse and the potential treatment, we must look at several facets of this topic. First, sociocultural factors. These are the influences from a person's environment and community. Age. Younger people may try substances out of curiosity or peer pressure. Older individuals might use substances for stress relief or coping. Employment status. Unemployment, job stress, or unstable income can increase risk. Cultural background. Different cultures may have varying attitudes toward substances, some more accepting while others are more restrictive. Religious, ethnic, and racial differences. Faith traditions, community values, or experiences of discrimination can shape whether someone is more vulnerable to substance use or more protected against it. Take that to mean that our social world in which we live heavily shapes substance use patterns. Second are the biological factors. These are influences from the body and brain. Genetics. Some people inherit a higher risk for addiction. If close family members struggle, their risk is greater. Neurotransmitter activity. Substances change how brain chemicals like dopamine and serotonin work, making them more rewarding and more challenging to give up. So, biology doesn't guarantee misuse, but it can make people more vulnerable. Third, psychological factors. These come from thoughts, feelings, and personal coping styles. Self-medication. Using substances to relieve anxiety, depression, or stress. Emotional pain. Turning to substances after trauma, grief, or conflict. Coping with negative experiences. Escaping difficult situations like abuse, school stress, or family conflict. Temporary escape. Seeking a break from life's problems through substances. For many, substance use is less about the substance itself and more about the relief or escape it seems to offer. Substance misuse isn't caused by just one thing. It's usually the result of a mix of social, biological, and psychological factors. Understanding these influences helps us see why prevention and treatment need to be holistic, addressing not just the drug, but the person and their world. What are some of the treatment protocols for substance misuse? When people decide to get help for substance misuse, treatment often involves several steps working together. Think of it like building a toolbox. Different tools help at different stages. 1. Detoxification. Detox. What it is. The process of clearing drugs or alcohol from the body. Why it matters. It helps people safely manage withdrawal symptoms under medical supervision. Key point. Detox is only the first step. It doesn't cure addiction, but it prepares the body for the next stages of recovery. 2. Psychological counseling. What it is. Therapy that helps people understand why they misuse substances. Focus areas. Coping with stress and emotions in healthier ways. Learning to change thought patterns and behaviors. Preventing relapse by building new skills. A few examples would be cognitive behavioral therapy, CBT, motivational interviewing, family therapy. Then there's 3, self-help programs. Examples: Alcoholics Anonymous, AA, and Narcotics Anonymous, NA. How they help: provide peer support from people who face the same struggles. Offer accountability through regular meetings and sponsorships. Create a sense of community and encouragement during recovery. The 4th one is therapeutic drugs. What it is: medications prescribed to reduce cravings or block the effects of drugs. Examples: methadone or buprenorphine for opioid addiction, naltrexone for alcohol or opioid dependence. Best when combined. Medication works best when paired with counseling and support programs. Well, this concludes Chapter 4. Be sure that you read the entire chapter, and if you have any questions, please feel free to ask or send a message via the inbox on Canvas. Keep a lookout for Chapter 5, which will be available soon. Thanks for listening.